COVID-19 activity is elevated right now in our area. The number of positive tests from the different providers in the area are up. Even though hospital admissions are still relatively low, we have seen an uptick in those over the past few weeks. We're encouraging everybody to continue to take precautions, wash your hands, stay home if you're sick, stay home if you test positive for COVID for 5 days. Get tested if you have symptoms or you suspect that you've been exposed to COVID, and stay up to date with your COVID vaccines. There's going to be an updated COVID vaccine available very soon. It's imminent. Right now we're waiting on, CDC has a committee called ACIP. It's the Advisory Committee on Immunization Practices, and they meet next Tuesday, the 12th. What these physicians do, they come together, they go through all the data on the vaccine, they vote and decide on the recommendations as far as who gets it, what age group the vaccines can be given to, who is at the greatest risk, so who needs to make sure that they get it. So they make all those decisions, make those recommendations, and then for us, the Tennessee Department of Health at the state level will write the protocols. They'll receive the vaccine and get it to us so that we're able to give it to the community. I wish I could give you an exact date that we would be receiving the new vaccine, but I can't. It all depends on those steps that I just mentioned. Our anticipation is that by the end of September, we will have it in hand and ready to give. But we're getting lots of phone calls about the new vaccine, and should they get it or should they come get the vaccine that we currently have because of the increase in the number of cases. And while we can't give you an exact answer on that, for the most part, we are encouraging most people just to wait because we're so close to having the new vaccine. This new vaccine targets that variant. It's currently circulating, so you'll have better protection with the new vaccine as opposed to the one that's currently out. With the commercialization, there will be a charge, there will be a fee associated. I don't know what that fee is going to be. I do feel like most insurances will cover the COVID vaccine. We know for a fact that Medicare, TennCare, Medicaid will cover it. You might want to check about with your private insurance if you have private insurance. There will be a program for the uninsured and the underinsured where vaccine will be made available. They may have to pay an administration fee that won't be more than $20, or that may be waived also. We'll know more when we get that information. The way we roll out this new vaccine is going to look a little bit different. In the past, you've been able to walk in the health department and we have a special place. You just walk in, fill out some brief paperwork, get your shot and leave. And so now we will have to be doing our billing. So they'll have to get some financial information from you at the front. And so that's going to require an appointment. We'll be putting that out along with the information with the new vaccine when we receive it. I hope we've addressed the questions that many of you have. If we haven't addressed your question or we can be of further assistance, feel free to call our COVID hotline number. You're going to see that pop up at the bottom of the screen, and just give us a call. We'll be glad to help you, and hope you all stay well.